Good day, caregivers. These are certainly crazy times we find ourselves in. I appreciate so much everyone's efforts over the last few weeks. It is amazing to see what we have accomplished together as a team. If you look at any of the things that we've done in isolation, they're a big deal. But when you look at them combined, it's incredible what we've all done. And it just shows you the importance of teamwork. So thank you for all that you've been doing to prepare us for COVID-19. Part of the challenge that we face is we've got to do things early to be prepared. And so that has meant protecting our community and each other by restricting visitors, as well as protecting limited personal protective equipment by doing things like eliminating non-essential procedures and office visits earlier than the wave of the disease has hit us. And so in some ways, it may feel a little weird to have free time or to have more time and to not necessarily be seeing patients while we don't have any COVID-19 patients in our facilities at the moment. But these things are important to make sure that we're ready when it does hit. When we look at the state epidemiological data, it shows that we're going to get the biggest wave of patients really starting around the third week of April. And that's a little ways off. And so it's important that we continue to prepare, do as much as we can before that hits, and also recognize that we've got to protect our workforce before it comes, which means we can't have anybody showing up to work sick. Because if you show up to work sick, then it might be a little bit later before other people start to realize that they may be sick. And then we may ultimately take out a large number of caregivers just before the time that we're really going to need them. Unfortunately, it doesn't look like that the wave of patients and expectations that we're going to see are going to peak until sometime toward the middle of May. And then it's not going to really subside until the later part of May into early June. So we still have a ways to go to get through this. So in addition to not coming to work sick, we need all of us continuing to practice good social distancing techniques, making sure that we're conducting those at home, in our offices, working from home when you can, washing your hands religiously, and really just making good, smart decisions. Trying as hard as you can not to travel, either out of the home and certainly not out of the state, and especially avoiding those areas where there are high concentrations of COVID-19 patients, places like New York City, Los Angeles, and others. So these are some things that I think are critically important. It is going to come. It is going to take a little bit longer, and the more we can prepare ahead of time, the better off we're going to be. I'm very proud of the work that everybody has done as we have conversations with other healthcare systems across the state. I continuously come back feeling that we're doing a little bit more, a little bit sooner, and that we're a couple of steps ahead many of the other health systems that we converse with. So thank you for that, and continue to wash your hands, and you all have a great day.